to the Wellness Show. I'm Dr. Keisha Christian, your host. So glad that you've tuned in for today's episode. Today, we are going to provide another compilation of episodes to share with you so that you can continue your journey into health and wellness in 2018. So we've had 4 major episodes recently to include Leslie Lyons from Stop Clinic that shares about quitting smoking. Our next episode that you will see is featuring Dr. Vijay Chaudhry from Triangle Physicians for Women, and he will share with us, the women, how we can continue to take care of ourselves and inspire us to live a life of wellness. Our next episode will be focused on pelvic health with Emily Wegman from Carolina Pelvic Health, and she will share with us, both men and women, how we can maintain a good pelvic health. Last but not least, and Dr. Leo Haig from Tryon Family Dentistry will be sharing with us on how we can maintain good oral care and dental health. So stay tuned for these few episodes, and I know you will enjoy them and be blessed, and they will continue you on your journey to health and wellness in 2018. Stay tuned. Share with us what factors, personalities, and behaviors make it difficult for smokers to stop smoking.
Well, as you've said before, and you know, nicotine is a very powerful addiction. It's hard to give it up. It's really hard. A lot of people who use drugs are suppressing emotional feelings.
Okay.
Sometimes they're suppressing pain, and it makes it very difficult to give it up. When we're kids and we start smoking, a lot of us have played around with it. It's a very fashionable thing to do. And then when we get older and we're hooked on it, it's really hard to give it up.
Sure.
For some people, it's still fashionable. They really enjoy it. And some people are in a state of denial, thinking that it's not really hurting them.
Okay.
And they don't really want to give it up until they are diagnosed with some horrible disease. That's sad but true.
That's unfortunate. Can you share with us some behavioral modifications that smokers would benefit from in helping them quit the nicotine habit?
Yes. When a person contacts me and asks me if they want, they'll come and they want to stop smoking, and they contact me, and the first contact is by phone. And after talking to them for a little while, I'll know whether I can commit to working with them. And if they have a real desire to stop smoking, then I really am easily able to help them.
Okay.
When they sign up for the program, the first thing I do is send them behavior modification exercises.
Oh, good.
Yes. These are designed to help them reduce their cigarette smoking, to address the mental part of the addiction, which is at least 50%.
Okay.
And begin the detox process. Everything that we do is based on rapid drug detox.
Interesting.
Yes. One of the biggest suggestions that I have for a person that's trying to give up the habit is to replace the void with nutritious food. So we ask that they increase their fruit, their vegetable, and their water intake, because this is going to help tremendously with the detox process.
Absolutely. I love that.
Yes. And if they do that, if they adhere to those suggestions, it makes it just easy, so easy for them to stop smoking.
Absolutely. And I think that it's a challenge for people because, sometimes it takes a little time to feed your body with good nutrition food and to see progress.
Yes.
And you want instant gratification, but that is maybe down the road a little bit, but when it happens, that instant gratification from eating healthier, exercising, and quitting the smoking habit, you feel great.
Yes.
And you have the capability of feeling great every day.
Yes, and sometimes it's being willing to make these changes, Because think about it, if you have someone that only eats one meal a day, and then you're asking them to eat a little bit frequently, that's a hard change for them.
Sure.
But then, as you say, once they make that change, they can't believe how much better they feel. They come in on their second visit, and that's one of the first things out of their mouth.
And that's great because, of course, they can always prevent a lot of the medical risks that they are susceptible because they're quitting smoking.
Yes.
So that is great. And then, of course, they're becoming healthier nutrition-wise and exercise-wise. So I love that.
Right.
I love that. Interesting.
Sometimes people even come in to work on the smoking cessation, and they start feeling so much better. They want to work on like a checklist of other problems that they're having.
Absolutely.
That
That's
they can
great.
cure with food.
Oh, wow. Interesting. And you can help them with that as well.
Mm-hmm.
That is great. Women who are pregnant, there are lots of misconceptions out there. I don't know if some of them stem from, back in years ago. Some of them may stem from cultural reasons.
Absolutely.
But some women have the understanding that they shouldn't exercise, or they shouldn't be careful on the food that they intake, or they shouldn't be careful as far as how much weight they may gain.
Right.
So if you could please share with us just some general guidelines, because I understand every situation is different, every woman is different, but in terms of exercise, nutrition, and an average weight that you should target throughout the 9 months of gaining, that can encourage a smoother labor and delivery experience.
It absolutely can.
As well as a healthy mama and a healthy expecting child.
That's right. So it's interesting because for generations, pregnancy was treated like a disability.
Right.
Right? I mean, you got pregnant and it was kind of nice. I mean, you sat around, everybody waited on you, they fed you, and people had healthy kids, but I think we figured out that that's not our life today.
Right.
I mean, women while they're pregnant don't sit around anymore.
Yes.
I mean, they work and they have other responsibilities and they're busy in their lives, and so certainly stress management is one thing. Trying to fit everything in your day can be rough, and then pregnancy on top of it is another piece of the puzzle, and that can be a little overwhelming. So managing stress is huge.
Yes, and then you have the hormones to
That's
balance
right.
out as
Absolutely,
well.
absolutely. I think that exercise is pretty important, right? I mean, would you ever run a marathon without training?
No.
Yeah, and
Although I did.
yeah, and
I wouldn't recommend it though.
that's right.
Definitely not.
You have to think about labor as running a marathon because it is a long process sometimes, and it's extremely taxing on your body.
Sure.
And so, the better cardiovascular conditioning you have, and the better shape you're in, the better you're going to do.
Absolutely.
And so, so I think that exercise is important. It's like training for labor. Okay. So I think that's really important. As far as the old misconception is when you were pregnant, you were eating for 2.
Right.
Right. So you doubled your calories and you fed your baby. That's not the case anymore. We don't believe that it's important that you eat for 2.
Right.
Usually we recommend an increase of 200 to 500 calories a day.
Okay.
Yeah. So that's not a lot.
No, it's not.
Average weight gain for a person of normal weight is about 25 to 35 pounds for a pregnancy. If you're a little overweight when you start, it can be as little as 15 to 25 pounds. And it's interesting because a lot of women feel like, what, I got to go out and I got to lose all this weight and then I'm going to get pregnant. But what tends to happen is they lose all that weight and then they get pregnant and they gain the 25 to 35 pounds of pregnancy plus what they lost. And so a lot of times I tell people, what, don't go lose all that weight.
Right.
Because what you can do instead is you can just gain less weight while you're pregnant. And I've had a lot of patients that gain 10, 20 pounds when they're overweight. They leave the hospital lighter than their pre-pregnancy weight.
Interesting.
And then, you know, they're nursing and that helps them lose weight.
Sure.
And so they might come in 15 or 20 pounds lighter than their pre-pregnancy weight. And they use that as a springboard toward long-term weight loss. And so, you know, so that's not a bad way to go.
Absolutely. Absolutely. That's a great recommendation.
If you're a little underweight, then, you know, you might gain a little extra weight. You have a
Sure.
little bit extra to go. But, you know, you want to, you know, take care of the diet and exercise, and you want to make sure that you're doing the right thing. But you also have to remember that pregnancy is one of the few times in your life where you can gain weight and people are actually happy for you.
Right.
And so you got to enjoy a little bit of that. You know, don't deprive yourself the entire pregnancy.
Sure.
You got some cravings, feed them.
Indulge a little bit.
Yeah,
Yes.
absolutely.
Yes.
And so, you know, it's important that, you know, everything in moderation,
Right.
right? So we want to make sure that we're healthy
Yes.
and we do the right thing, but at the same time, we want to enjoy it a little bit.
Right. Right. And I just want to touch a little bit on women that are experiencing menopause. There's always
Sure.
this buzz, whether in the office, at home with family members, or even at the gym, about some of the uncomfortable experiences that they may have.
Sure.
And so share with us some of the signs and symptoms that are common to
Absolutely,
menopause.
yeah. So it's interesting because people in their 40s, you know, they get menstrual migraines and they get breast tenderness and they get irregular bleeding and they get heavier bleeding. And one of the things that they come in and they go, you know what, I'm really looking forward to menopause.
Huh.
And I always say, well, you know what, the grass is not always greener on the other side. Menopause is rough. I mean, you know, there are changes that occur. I mean, you know, and it can start with something as simple as hot flashes,
Sure.
night sweats, and vaginal dryness.
Okay.
You know, and those are things that can be pretty mild, or they can be completely debilitating.
Sure.
You know, other symptoms of menopause can include sexual dysfunction, pain with intercourse, changes in the way your orgasms feel. You know, you can have issues related to your cognition, you know, weight gain, particularly in the midsection,
Right.
which drives women crazy. You know, you might experience changes in your skin and changes to the texture of your hair. And so, you know, menopause can be difficult.
Sure.
Now, not everybody experiences these symptoms.
Right.
You know, so treatment oftentimes needs to be tailored for what you're feeling.
Now, is it true that some women don't even experience menopause?
Absolutely, yes.
symptoms?
Some people don't, and
Okay.
you know, so you know, people who tend to be thinner don't get as many menopausal symptoms.
Interesting.
People who are in better shape, exercise, they tend to get fewer menopausal symptoms. People who eat a really lean, healthy diet, they tend to get fewer menopausal symptoms.
Okay.
And so, you know, women lower stress. You know, so you know, it's funny because when we look at medical conditions, it seems like there's always a few themes, and it's always diet, exercise, weight, you know, maintaining low stress, you know, and it helps in all aspects of your health.
It does. So today we're talking about pelvic health, and we want to hear about the different structures and components of the pelvic floor. So a little bit of Anatomy 101.
Yeah, so I have a little handy model with me. So
Okay.
this is a female model of the pelvic floor. So we'll kind of learn a little bit about the muscles, but to know first that they're skeletal muscles, just like our arm or leg muscles. That's really important. People don't always know that they have muscles that they can voluntarily contract and relax or expand based on what they need to do. And they do have a little autonomic nervous system innervation, which is great, so we don't have to worry about losing control of our urine or passing gas when we don't want to. So there's always a little bit of control going on there. But the muscles are skeletal muscles, and they go from your pubic bone, which is at the front of the pelvis here. The two pelvic bones come together to make your pubic symphysis. And then they meet in the back with your sacrum to make your sacroiliac joint. And right at the bottom of that is your tailbone. And we all kind of know about that tailbone. Maybe we've fallen on it once, and it might have a little soreness. But the tail is very important for supporting the pelvic floor muscles as a site of attachment. And the muscles are like a hammock or a sling going from the tailbone to the pubic bone, and then side to side from the sit bone to sit bone, those bones that we sit on. So they're layered. We have our urogenital triangle muscles, and then the deeper muscles of the rectum and the pelvis, which are called your levator ani muscles. So, and this is that hammock or sling going from pubic bone to tailbone and back out. And they're also very unique because they attach onto a hip muscle called the obturator internus. And so they really play a role in hip dynamic function, as well as supporting the bony pelvis and the organs. So the pelvic floor has a big role in supporting the pelvis, but also the organs. It's the bladder, in women the uterus and the rectum, and in men the bladder and the rectum, so that the organs stay in place. They're a dynamic stabilizer with our abdominal wall and our diaphragm and our back muscles to stabilize the pelvis and the spine. And then they also work with our hip muscles so we can walk and run and jump and not lose any control of our bladder or our bowel. So they really play a primary role in both mobility, but also just daily activities.
Absolutely.
And bodily functions.
Yeah, so hence we want everything working properly so that, number one, we have pelvic health, but also health throughout our entire body as well, and able to function well, able to do all the various activities that we are able to do.
Yeah.
So share with us some of the common pelvic disorders that you may treat with both women and men.
Yeah, so the role of the pelvic floor is really to be supportive of our bladder function, our bowel function, and our sexual health. So oftentimes we'll see folks that have leaking of urine with maybe cough or sneeze or running or other jumping activities. Or maybe they have to go to the bathroom all the time, and they're the folks that know where all the bathrooms in the mall and the neighborhood are, so that they're not going to have a leakage event when they're out and about. And some folks may have difficulty emptying the bladder, or may say that they have a shy bladder, and that's usually related to muscle tension and not being able to relax. And then we have folks that have bowel problems like chronic constipation. The pelvic floor actually has to relax in order for us to have a bowel movement. And if we're holding it tight all the time, we can lead to chronic constipation and then sometimes even fecal incontinence. So we deal with those types of issues, all the embarrassing issues.
Sure.
And then sexual health is a big one. So some folks may have problems where they can't have intercourse at all because the muscles are so tight. We call that vaginismus. And they basically have a protective tightening response. And so we'll help those women really overcome that fear of penetration, whether it be for tampon use or GYN exam or intimacy. And sometimes we have folks that have problems after having baby. Maybe they've had a scar from tearing or episiotomies, and those muscles needs to heal, and so we'll help with scar mobilization and really helping them have that intimacy again and comfortable muscle mobility. And then as well, some folks just want to have a more exciting sexual experience, and so the muscles help with pleasure, so we'll help with that. And then men may have problems after prostate surgery, or they too can have problems with pelvic floor tension, which leads to difficulty with bowel and bladder control and sexual activity. So those are the primary pelvic issues, but we also see secondary, because of that attachment to the hip, that we have problems with hip labral tears, hip pain on the outside, chronic SI pain, coccydynia or tailbone pain, and then persistent low back pain, because your core is, your pelvic floor is really a part of that core system, and so if you're not using it correctly, then it's difficult to do all those strengthening exercises to support the hip and the back. So.
That makes sense.
Yeah.
That does make sense. Thank you for bringing it all together for us.
Yeah, so kind of do it all, inside and out.
Absolutely,
Yeah.
absolutely. It's interesting to hear about, all the structures and the responsibilities of the structures and how that affects our entire life, our bodies, and our entire life. And very good. and share with us some of the common treatments that you employ with people who have pelvic dysfunction.
Yeah, so even though pelvic floor therapy seems a little bit different than regular physical therapy, we're still doing regular physical therapy. So after we do our muscular assessment, we may teach you how to coordinate your muscles. So we do some retraining of your neuromuscular system. We often use the breathing to help with timing and coordinating with your pelvic floor and your abdominal wall. So most folks are going to learn how to breathe on day one, and everyone's like, why am I learning how to breathe, and why is this so hard? But the diaphragm and the pelvic floor connection is really critical for managing that intra-abdominal pressure. So we use a lot of neuromuscular retraining, and then we use hands-on techniques called manual therapy if we need to do any soft tissue mobilization or move the joints that might be stiff. And then our primary goal is to get folks exercising and moving, just like all regular physical therapy. So we start a home exercise program on day one, and then we continue to progress that over the coming visits. And we analyze your movement, and in fact, I've had patients where, you know, I'm leaking when I'm bending over, when I'm maybe feeding the dog, and just like any other physical therapy visit, well, let's see you do that.
Right.
We analyze the movement while you're bending at the waist instead of squatting. We teach you how to squat properly, and you're no longer leaking. It's an
Wonderful.
easy fix. So those are the easy ones.
Yes, I was going to say,
Yeah.
yes, those are the easy ones. And it's
Yeah.
great because it restores function, and you're able to actually look at a person's general movements and movements where they're also having the issues and correct those and give recommendations and suggestions, and so they can continue and be restored and continue those various activities.
Exactly.
Okay, so I want to first talk about oral hygiene, because that's very important.
That's why we're here.
Yes, absolutely, absolutely. So share with us some of the causes for gingivitis, gum disease, and periodontal disease.
Lack of maintenance. That's one of the big things. The biggest thing we see are patients not keeping on their 6-month, 3-month recalls, depending on their level of periodontal disease or gingival inflammation. Patients, you know, and we hear this a lot, life gets going pretty quick. If we have to do things like haircuts, things like that. Staying on a 6-month recall is one of the best things you can do. And 3-month recalls, 4-month recalls are in certain situations. You know, home care is great, but what we do here at this office augments that as well. It helps out a lot too.
Yes, I agree. I'll tell you, years ago, I wasn't as routine with my dental care, my home maintenance care, as well as coming into the dentist. And what a difference by every day doing what I was requested to do on a daily basis. It makes a big difference. And also when you're maintaining it at home, it just makes the dental visit so much easier for us, the patient, and I'm sure for you as well.
Oh, my hygienist, I should say.
Yeah, your hygienist. But it goes by a lot faster, and it can be a lot more comfortable.
It is, and it's a lot better for the patient. It's a lot better, obviously, the hygienist. We have less to talk about. There's no surprises, and it's keeping on the 6-month recall is one of the best things you can do.
Absolutely. So, what are some of the risk factors for those conditions as well?
Wide range of risk factors. One of the things that we see a lot are patients that have the beginnings of periodontal disease, and a lot of times we're seeing patients going to dental offices that don't do probing depths, don't do the measurements, don't go through the attachment levels with the patients.
Okay.
And so the cleaning, what they'll do is they'll leave the base of that pocket, they'll leave the calculus, they'll leave the bacteria in there because it's hard to clean. But that, not getting that little bit causes vertical bone loss in certain teeth. And one of the big things we're seeing is patients will say, well, I've been to the dentist for the last 5 years, every 6 months, but they haven't treated the disease. They treated part of the disease. And then it's unfortunate for us that we have to talk about vertical bone loss, the tooth being compromised, possible implants, things like that the patients have never heard before. So those type of things can sneak up on you, and then that gets back to that 6 month.
Yeah, okay, interesting. So it is important that you are involved in your care and also asking questions as the patient.
Absolutely, and then the other end of it, the less serious side is just regular gum inflammation. It's the same bacteria that, it's a systemic disease. So
Sure.
you have to be careful with that, especially patients that have just had surgeries for hips or heart valves, things like that. That's a big risk factor as well.
Right, and some of the signs of those conditions as well as...
One of the most common signs or complaints we hear with patients that their tissue bleeds when they floss, so they stop. And that's us telling them, when they come in, that it shouldn't bleed.
Right.
The more you do it, the less it will stop.
Right,
Or the more it will stop, sorry.
Okay, so that makes sense. Okay, so when flossing, if you're noticing bleeding, that's when it's time to be concerned
That's a
and
problem.
contact you.
That's
We've got to get it taken care of. Yes, absolutely. Now, and what if we do not take care of it and we just avoid it? What are the consequences?
Well, the end consequence could be the patients I'm treating now that are fully edentulous, that don't have teeth or they couldn't save their teeth. So now we're talking about full mouth reconstructions through implants, either through an implant retained denture or a fixed prosthetic. So you're talking about losing your teeth, and you're also talking about quite a bit of money trying to replace it. It's a lot cheaper. We tell our patients all the time, it's a lot cheaper and a lot easier to keep your teeth.
Preventative measures, yes. Maintenance is important, very important, and monumentally important. And, sometimes I think, I wish we were like sharks. Sharks, their teeth get replaced, right? But humans, when we get our adult teeth, that's it. So you get one chance when you become an adult, you have your adult teeth, and that's it. They don't replace.
We see kids, we call them their first set teeth, their practice teeth.
They're practicing. Yes. But when you become an adult, when you get your adult teeth, make sure you're definitely taking care of them. So that's good that you see from children all the way up. So you can get them in that pattern of course, flossing, brushing their teeth, and that is really important for their future care of their teeth and maintaining their teeth. Well, since we're on that topic of brushing and flossing, I want to add some interest to it. Flossing and water picks, similar benefits or is it different?
They go hand in hand.
Okay.
So a water flosser will do its job and a floss will do its job.
Okay.
So for instance, a water flosser will not get into any contact with the teeth, and that's where we see a lot of the cavities forming.
Got it.
But a water flosser will get better into the gingival sulcus. So we tell patients to use both.
Okay.
A water pick is a great device. In fact, once we turn a patient onto it, it's almost addiction. Because they realize, what I always tell patients is go out to dinner, don't floss after you get back, don't use a toothpick, and then use your water flosser and see what comes out.
Okay. Interesting.
That's an eye-opening experience to patients, and then they start getting addicted to it because they know what's in there.
Right. And I know by any means it does not replace, of course, going to the dentist. But do you get that same feeling after using the water pick as when you go to the dentist and your teeth feel like sparkling clean?
That's right. Well, you maintain it. So
Okay.
for instance, if you were to come in and see me this morning and then use your water pick and use your water pick the next day, it would elongate that clean
Okay, interesting, because I love that. Right after I go to the dentist, I do not want to eat anything.
It is a relief. I mean, you got something taken care of. So
Yeah.
it's absolute relief. You're exactly right.
Absolutely.